Okay, so if you or someone you love is expecting a baby, there's a word you might hear that can sound a little scary: preeclampsia. It's a really common but also really serious pregnancy complication. Honestly, just understanding what it is one of the most powerful things you can do. So let's get into it.
And this is not some super rare thing we're talking about. High blood pressure issues, well, they affect a ton of pregnancies all over the world. We're talking as many as 1 in every 10. That means there's a really good chance someone you know has dealt with this, which is exactly why we need to talk about it.
So here's our game plan for this explainer. We're going to break it all down step by step. First, what are we even talking about? Then, we'll dig into what actually causes preeclampsia, what risks and warning signs you need to look for, and finally, how doctors handle it to keep mom and baby safe.
All right, first things first. It's so important to get this one thing straight. While it all kicks off with a high blood pressure reading, preeclampsia is way more than that. It's what we call a systemic condition, meaning it can mess with the entire body.
The story usually starts with something called gestational hypertension. Think of this as the first yellow flag. It's when your blood pressure, specifically a number over 140/90, pops up for the very first time after you're 20 weeks pregnant. This is why they check your BP at every single appointment. But the key here is, there's no protein in the urine. Not yet anyway.
So what turns that yellow flag into a bright red one? What's the real difference between just having high blood pressure and having full-blown preeclampsia? Well, that distinction is absolutely everything when it comes to getting the right diagnosis.
Preeclampsia gets diagnosed when you've got that same high blood pressure, but now a new clue shows up: protein in your urine. They call it proteinuria. And this is a huge sign that the high blood pressure is starting to stress out other organs. See, your kidneys are like a superfine filter, right? When they get stressed, that filter gets a little damaged and protein starts to leak through where it really shouldn't be.
And if preeclampsia isn't managed and it keeps progressing, it can turn into eclampsia. This is the most dangerous stage of all. It's where the condition starts to affect the brain, which can lead to seizures. This is a true medical emergency, and it's precisely why catching and managing preeclampsia early is so important.
Now, this flowchart is great because it basically maps out how a doctor thinks. You can see that clear fork in the road. High blood pressure shows up after 20 weeks. Okay. The next question is simple. Is there protein in the urine? If it's a no, you're looking at gestational hypertension. If it's a yes, well, that leads you straight to a preeclampsia diagnosis. It just perfectly shows you that one crucial difference.
So why? Why does this even happen? For the longest time, it was kind of a mystery. But now we're pretty sure that the research points to one culprit: the placenta. The problem doesn't start with the mom's health in general. It starts with that amazing organ connecting her to the baby.
It all begins with how the placenta attaches itself. In a healthy pregnancy, the placenta's roots dig really deep into the uterine wall to get a nice, rich blood supply. But with preeclampsia, that process is just too shallow. It's kind of like trying to build a giant skyscraper on a weak foundation. It's just not secure enough to handle the incredible demands of a growing baby. And because that foundation is shallow, the next crucial step gets all messed up. The arteries in the uterus are supposed to totally transform. They widen out into these massive, high-flow pipelines to flood the placenta with everything it needs. But in this case, they stay narrow and tight. Imagine the main highways into a big city never got widened for rush hour. You'd have a system-wide traffic jam, right?
So with those supply lines totally gridlocked, the placenta itself starts to get really stressed out. It's not getting enough blood, which means it's not getting enough oxygen. And a placenta that's starved for oxygen is an unhappy and ultimately a dangerous one.
In response to being starved, the placenta starts sending out these SOS signals, basically a nasty cocktail of distress chemicals, into the mom's bloodstream. These are things that cause inflammation and actually damage blood vessels, and this is the exact moment the problem escapes the uterus and goes body-wide.
So these harmful factors race through the mother's body, and they start attacking the delicate inner lining of her blood vessels. This is called endothelial dysfunction. Damaged vessels do two really bad things. First, they clamp down and get super tight, which makes blood pressure skyrocket. And second, they get leaky, which lets fluid escape into tissues, that causes the swelling, and lets proteins spill into the urine.
In this picture, this just shows you the end result of that whole chain reaction perfectly. On the top, you've got a normal, wide-open artery from a healthy pregnancy. And below it, you see that narrowed artery in preeclampsia, clamped down by all those factors we just talked about.
This one change happening all over the body is what creates that dangerous high blood pressure.
Okay, so now that we get the complex why behind this whole thing, let's talk about the practical what. What are the specific risk factors, and what are the critical warning signs that every expecting parent and their family absolutely needs to know?
So there are a few things that can up the odds. Things like your age, being on the younger or older side of your childbearing years, or if it runs in your family, especially if your mom or sister had it. If you already have something like chronic high blood pressure or diabetes, that plays a role too. It's also more common in first pregnancies, and even first pregnancies with a new partner. And of course, carrying twins or triplets puts extra strain on everything.
This slide right here is your non-negotiable checklist. And listen, we are not talking about the usual pregnancy aches and pains. A huge warning sign is a severe headache that just won't go away, even with Tylenol. Or seeing spots, floaters, any weird vision changes. Another one is a sharp pain in your upper right belly, right under your ribs. That's where your liver is. These are signs you need to call your doctor or midwife, like right away.
Now, some ankle swelling in pregnancy is totally normal. But the kind of swelling we're talking about here, edema, is different. It's usually sudden, it's severe, and it can affect your hands and your face. But here's the key test. It's called pitting edema. If you press your thumb into a swollen spot, like your shin, and it leaves a little dent that stays for a few seconds, just like in this picture, that's a major red flag you need to report.
I know. Hearing about all these symptoms can be pretty frightening. But here is the most important part of all of this. Preeclampsia is understood and it is manageable. The goal is always the same. Keep both mom and baby as safe as possible until it's time to deliver.
This quote really just nails the whole strategy. It's a delicate balancing act. On one side, doctors want to give the baby as much time as they can to grow and mature inside. But on the other side, they absolutely cannot risk the mother's health getting worse. Every single decision they make is about weighing those two priorities.
And this table shows you exactly how that balancing act plays out in the real world. If it's just hypertension, it's usually managed with close monitoring from home, aiming for delivery around 37 weeks. But the second that protein shows up, it usually means a hospital stay for constant observation. And if those severe symptoms appear, that's an emergency admission. The goal becomes stabilize mom and then deliver the baby no matter how many weeks along she is.
And this is the crucial takeaway. While there are medications that can help manage blood pressure and prevent seizures, they don't fix the root cause. The one and only definitive cure is to deliver the baby and, this is critical, the placenta. Because once the source of the whole problem is gone, the body can finally start to heal.
Look, preeclampsia is serious, there's no doubt about it, but it is manageable with good medical care. Knowing the signs, understanding your own risks, and never, ever being afraid to speak up about a symptom, that is the most powerful tool you have. So just think about it for a second. What's the one thing you've learned here that you could share with an expecting parent in your life? Because having that conversation really could make all the difference.